Hello, my name is Jones, and welcome to part 2 of our series of IMCI, that is Integrated Management of Childhood Illness. Okay, so in part 2 of this, we are looking at IMCI process for children aged 2 months to 5 years. Okay, we are going to follow the IMCI process that we outlined in part 1. Okay, so we'll be doing the assess and classifying of the child of 2 months to 5 years. So the steps would be: A, greet the mother appropriately as she comes to the center and ask about the child. You can look to see if the child's weight and temperature have been recorded. You can ask the mother what the child's problem are, and then C, determine if this is an initial or follow-up visit, or that is for the problem or current problem that the child is facing. Then D, you can check for general danger signs. So as you are assessing and classifying the child aged 2 months to 5 years, your steps that you can follow here is first greet and welcome the mother. It's very important so that she's calm as you are talking to her. So you greet the mother appropriately and ask about the child's health. You can look to see if the child's weight and temperature have been recorded. Okay, so this is in the child's card. Okay, then B, you can ask the mother what the child's problem are. So it's important you ask the current problem that the child has, and then also determine if it is an initial visit or a follow-up visit, okay, for the problem that the child has presented with. Then D, you check for general danger signs. Okay, so how now do you check for danger sign? It's important that you know what we ask, okay, the caregiver, and what we look for. So what we ask is if the child is able to drink or breastfeed, or we can also ask, does the child vomit everything? Okay, and then the third question is if the child has had convulsion in the illness. Then what we can look for as general danger signs include seeing if the child is lethargic or unconscious. And then the second part is seeing if the child is convulsing at that moment. A child with any danger sign requires urgent attention. So for this one, the color code is pink or red. So you can complete the assessment, give a pre-referral treatment immediately, and give start doses, and refer without delay for a child with any of the danger sign. So the color code for danger signs here is red. If the child has any danger sign, okay, so that is under classification. And you need to know that this, we are going to look at it as very severe disease. And for very severe disease, some of the actions or interventions are, if the child has, let's say, convulsed, you can give diazepam. Okay, you can complete the assessment first and then you give a pre-referral treatment, and also treat. You can treat to prevent low blood sugar or reduce hypoglycemia by giving at least something to help boost up the sugar. You have to keep the child warm and refer urgently under these danger signs. Okay, so now let's look at the first condition here in IMCI for children between 2 to 5 years. So the first condition that we are going to look at is pneumonia. So we are going to look how to assess, classify, identify treatment, treat, and cancel this child using these steps of the IMCI process. We are going to learn how to assess and classify, okay, Okay, we are going to learn how to do that, how to assess, classify, identify treatment, treat, and cancel. So, our first condition is pneumonia. So, ask about the main symptom. Does the child have cough or difficulties in breathing? So, these are the main symptoms in pneumonia. If yes, you can ask for how long. Okay, then you can look, listen, and feel. So, what do you have to look, listen, and feel for? So, A, you can count the breaths per minute. You can look for chest indrawing. You can look at and listen for stridor. You can look and listen for wheezing. You must know that as you are examining the child should be calm so that all these parameters can be within normal range in a normal circumstance. So we are saying in assessing for pneumonia, you can ask about the main symptom. Does the child have cough or difficulties in breathing? These are very, very, very important. Okay, cough and difficulties in breathing, which is the sign of signs we see in pneumonia. Okay, then if yes, it's important you ask for how long. The reason we're asking this because cough in TB can be for more than 2 weeks. It can be for a month or so. So we want to rule out tuberculosis. Okay, we just want to rule out other chronic obstructive pulmonary diseases. Okay, so you look, listen, and feel. So as you are doing this, we are saying you count the breaths per minute, so you can look for that. So you can look for chest indrawing, look and listen for stridor, look and listen for wheezing. And as you are doing this, the child must be calm. Okay, so you can ask about the main symptom. Does the child have cough or difficulties in breathing? So in asking, we are saying, does the child have cough or difficulties in breathing? Okay, so that is the way you phrase the question. Does the child have a cough or difficulties in breathing? So if caretaker says yes, ask the next question. How long? So a child who has had cough or difficulties in breathing for more than 14 days, it means that one has chronic cough. So after that, you can count breaths per minute. Okay, so then you can look for the following danger sign to do with pneumonia or to do with conditions affecting the respiratory tract. So what are the danger signs specific to diseases that affect the respiratory tract? So 1 is fast breathing. 2 is chest indrawing. 3 is stridor. 4 is wheezing in a calm child. So these are danger signs for pneumonia or conditions of the respiratory tract. So it is important that you rule them out as you are examining a child with a respiratory tract infection. Okay, so fast breathing. Then the cutoff points for fast breathing are as follows. If a child is 2 months up to 12 months, fast breathing is 50 breaths per minute or more. While a child from 12 months to about 5 years, fast breathing is 40 breaths per minute or more. It's important that you know these parameters because the younger the child, the faster the breaths. So any 50 breaths or more. Okay, if a child is 2 months up to 12 months, we are saying fast breathing is 50 breaths per minute. Whilst those that are about 1 year or 12 months up to 5 years, fast breathing will be 40 breaths per minute or more. Okay, so in classifying pneumonia, we are saying after you assess for the main symptoms and related signs, you can classify the child's illness as follows. 1, we are saying severe pneumonia or very severe disease. Under the color codes, this will fall under the red or pink row. Okay, when we say severe, very severe disease, that is red or pink row. Okay, so here, because the child has had a cough and has fast breathing, we are saying severe pneumonia. So any general danger sign or chest indrawing specific to respiratory condition, chest indrawing, stridor, or in a calm child, it will prompt you to classify it as severe pneumonia. Okay, so the next step is identify treatment for severe pneumonia or severe febrile disease. So you can give first dose of appropriate antibiotic and to do this you can refer to the chart booklet. Within the chart booklet,
his mother told us that she brought Ben to the clinic because he has a cough.
Treat wheezing if present. Okay, so how do you treat wheezing? You can refer to the chart booklet. Then treat the child to prevent low blood sugar. Also, this information is present in the chart booklet. Then, because there is presence of a danger sign, you refer urgently to the hospital if you are at the health facility. Okay, so in assessing and classifying for pneumonia, the color codes here will be in the following way. Okay, so we are going to have the green color, the yellow color, and the pink or red color. Okay, so under the columns, we will look at the signs and then classify as the second column, and then the third column, the treatment. Okay, so under the rows, we look at the different color codes. Under the rows, we look at the different color codes, and that is green, first row at the bottom, yellow, second row in the middle, and then red or pink, that is the topmost row. All right, so now, the bottom row,
we heard a wheezing sound when breathing out.
You have no signs of pneumonia or very severe disease. This you are going to classify.
How many breaths did you count? We counted 66
green row. So you're going to classify as cough or cold. Signs.
Here is the second child.
Or very severe disease. Then, under classification, this will be cough or cold. Under treatment, if wheezing, you can give bronchodilator for about 5 days.
If the child has a cough or difficult breathing, ask
for how long?
You can soothe the throat and relieve the cough for those children that
we saw normal breathing.
If coughing for more than 30 days, this may show possibility of TB or other chronic obstructive diseases like asthma. Advise mother when to return immediately.
Here is the third child.
5 days if not improving. Under the yellow code, here we are looking at the child who has fast breathing, and we have established what fast breathing is according to age group. So signs here, we just have fast breathing. Classify this one, we're going to classify it as pneumonia. So fast breathing is a sign of pneumonia, so it is classified as pneumonia. For treatment, you can give the oral antibiotic for about 5 days. Okay, if wheezing, you can give bronchodilators. If recurrent wheezing, refer for assessment. You can give something to soothe the throat. You can check for other underlying infections like also HIV. And if coughing for more than 30 days, you can screen for tuberculosis or test for possible tuberculosis. You can advise the mother when to return immediately and follow up in 2 days. Okay, so this is under the the middle yellow row. Then when we move on to the red row, under signs, if the child has any general danger sign or chest in drawing or stridor in a calm child. Okay, so if the child has any of the danger signs or the specific danger signs like chest in drawing or stridor, this we classify it as pneumonia, severe pneumonia, or very severe disease. So that is the diagnosis according to IMCI. So here, under treatment, or we are saying give first dose of antibiotic, and this one you are likely to give IM for quick relief, faster action. If wheezing, bronchodilators can be given, okay, and then you can refer urgently to the hospital if you are working at the health facility. Okay, so what we are saying is pneumonia, yellow, the sick child is classified to have pneumonia if he or she has fast breathing. Identifying treatment, here we are saying give oral antibiotic. If wheezing, give rapid acting bronchodilator. Okay, soothe the throat and relieve cough with safe remedy. Check HIV status and give follow-up in 2 days. Okay, so cough or cold, which is under the green row, here we're saying the sick child is classified under cough or cold when there is no sign of severe disease or pneumonia. So treatment, a child with cough or cold does not need antibiotics. Here, simply advise the caretaker on safe remedy for cough and soothe the throat, e.g. warm tea with sugar. Advised to watch for fast breathing or difficulties in breathing. You can then review the child after 5 days. Okay, so we've managed to assess and classify pneumonia, and now let's look at how to assess and classify diarrhea. Diarrhea is defined as 3 or more loose watery stool in 24-hour period. Most diarrheas which cause dehydrations, dehydration are loose or watery. Cholera is one example of loose or watery diarrhea. If an episode of diarrhea lasts less than 12 days, it is acute diarrhea. So acute watery diarrhea causes dehydration and contributes to malnutrition. If the diarrhea lasts 14 days or more, we identify it as persistent diarrhea. So up to 20% of episodes of diarrhea become persistent. Persistent diarrhea often causes nutritional problems, as most of the nutrients are being lost in the stool. So diarrhea with blood in the stool, with or without mucus, this will be classified as dysentery. The most common cause of dysentery is Shigella bacteria. Amoebic dysentery is not common in young children. A child may have both watery diarrhea and dysentery. Okay, so the pinching of the skin is done to classify diarrhea for dehydration. Okay, so you can do that in looking at the level of dehydration. So there are 3 status of classification for child with diarrhea.
Offer the child fluid.
So there are 3 status. So
is the child not able to drink or drinking poorly? Is he drinking eagerly, thirsty, or does he drink normally?
There are 3 status.
This child is not able to drink at all.
If diarrhea is 14 days or more, if there is blood or in the stool,
this child is obviously thirsty and drinks eagerly.
Okay, so
often the thirsty child grabs for the spoon or cup.
We give it, let's say yellow, there is blood in the stool.
This child is drinking normally. He is not thirsty.
So the appropriate treatment for dysentery, bacterial dysentery, will be ciprofloxacin, at least for about 5 days, okay, and follow up in 2 days. Okay, then we can also have a yellow for no dehydration, but just history of passing water is too. Okay, so this can be persistent diarrhea. Okay, persistent diarrhea or chronic diarrhea. Here you can check for HIV status, advise on hygiene, and give multivitamin and zinc, okay, to help control this. Okay, if dehydration is present, okay, and there is severe persistent diarrhea, you can treat for dehydration and refer unless otherwise you don't know. Let's say the child has no other severe classification, but you can refer to the hospital. Okay, so the other parts, if you had to look at the green row in diarrhea, we are saying not enough signs to classify as some or severe dehydration. Mind you, diarrhea, we look at passage of loose stool of more than 3 times in 24 hours. So if there isn't that, there's just history of passing watery stool, then this one will say classification, no dehydration. Okay, then you can give zinc supplements and food to treat diarrhea at home. Like you can use what we call Plan A. Okay. Then the next classification is where the patient has some signs of dehydration. So this will fall under the yellow line. Okay, so this will fall under the yellow line where there is baby's restless, irritable, sunken eyes, drinks eagerly, tasty, skin pinch, goes back slowly. These are the signs. Then this will be some dehydration, and you have to give fluid, zinc supplements. Okay, and if the child has some severe classification there, you can refer to the hospital. But if the child doesn't have some severe or danger signs, you can give appropriate antibiotic. So classification here, it will be just some dehydration under yellow. Okay, so it will be some dehydration. So in diarrhea, we have these two yellows, or we have these 3 yellows. We have yellows for some dehydration. We have yellow for persistent diarrhea, okay, with no dehydration, where you might need to check for HIV status. And we also have yellow where there is blood in a stool. Okay, so if there is blood in stool, the classification will be decently. Okay, all right. So those are the 3 yellows that you find. Then we have 2 pinks. Okay, we have 2 pink, or we have 2 red codes in diarrhea. So the first yellow, which we have discussed, is dehydration is present. We say severe persistent diarrhea. So here we are necessarily looking at the child who's having persistent diarrhea and there is dehydration. So here you can refer and also do other investigations, okay, to rule out other chronic infections that may cause this. So then after that, we look at the green, no dehydration, yellow, some dehydration, and then red, severe dehydration. So now this now forms the severe illness here, or severe disease. So in severe disease, the signs, okay, that we can see is lethargic or unconscious child, sunken eyes, not able to drink, okay, or not able to drink, okay, or maybe drinks poorly. The child, as you are pouring water on his mouth, just drinks it poorly, or skin pinch goes back very slowly. Okay, so here it goes back very, very slowly. And then when you talk about the yellow part here, skin goes back just slowly, but on the red part, it goes back very slowly. Okay, so the classification is severe dehydration. So severe dehydration, you can treat using plan C. Some dehydration, you can treat using plan B. No dehydration, you treat using plan A. Okay, so that is how you manage this one. So any child under this classification and ESA fluid, you can also put some IV fluid for plan C. Okay, so now classification of diarrhea has been now discussed. So we need now to assess and classify fever. Okay, let's assess and classify fever. So in IMCI, a child with fever may have malaria, meningitis, measles, otitis media, or another severe disease. Okay, so fever in children may also be caused by cough or cold or other viral infection. So a child regarded as having fever by history feels hot or the temperature is high or higher than 37.5. So in assessment, you ask if the child has had fever. If yes, then ask for how long. If more than 7 days the child has fever, then you can ask if the fever has been present every day. You can look and feel for stiff neck to rule out meningitis or meningeal irritation. Ask the parent or caretaker for history of fever or if the child's body feels hot. The child has a history of fever if the child has had any fever with this illness that the child has presented with at the hospital. So you can measure the body temperature of all sick children or child in this case. Okay, so you need to ask if the child has had measles in the last 3 months. So you can look for signs of measles. So signs of measles include generalized rash, and one of these is cough, runny nose, or red eyes. If the child has measles with that is within the last 3 months, you can look for complications of measles. The complications of measles include things that you need to look for are mouth ulcers. Okay, you need to look if they are deep or extensive, as it will help you in the classification of these measles. You need to also assess, okay, or look for past drainage from the eyes. Then also look for crowding of the cornea. So these complications are very cardinal in assessing for measles, that is mouth ulcers, past draining from the eyes, and crowding of the cornea. So classification of fever. If the child has fever and no signs of measles, you can classify for fever only. If the child has signs of both fever and measles, classify fever and the measles. So there are 3 possible classifications of fever: very severe febrile disease, or maybe just cerebral malaria. Okay, so now, after we have assessed for all these, then what are we saying? Under red in this one for fever, we are saying any general danger signs with a stiff neck, that would be a sign of very severe febrile disease, or that is cerebral malaria, or malaria affecting the meninges of the brain, meningitis. So you can give first dose of artesunate and give the first dose of appropriate antibiotic, treat with quinine, okay, and give a dose of paracetamol, and refer urgently if you are working at the center. Then under yellow, if RDT are positive, you get the time, then classification will just be malaria. But you need to know that the signs is that the RDT is positive, but there should be no signs of runny nose, no measles, signs of measles, or no other causes. Then that's when you are going to say malaria, because RDT is positive. So you treat the child with oral antimalarial and give the dose of paracetamol. Advise mother when to return immediately and follow up in 2 days. So treating for severe febrile disease, as we have mentioned, is the treatment that we have just mentioned. Okay, so in classifying for measles, it's the child who presents under green. We can say the child has measles, okay, or within the last 3 months the child had measles. Then we'll just look at that one as measles and give vitamin A and follow up in 14 days. But if the child under yellow code for measles, we are saying the child may have pus draining from the eye or mouth ulcers. Okay, so here they just have mouth ulcers. So this is measles with eye or mouth complication. Okay, so there's just some pus draining from the eye, or there are some mouth ulcers. So this is measles with eye or mouth complication. So these are generally mild complication in measles. So you're going to classify it as measles with eye or mouth complication. So the treatment here is just giving vitamin A. Okay, if pus draining, you can give tetracycline eye ointment. If mouth ulcers, you can give, you can be using gentian violet and follow up in 2 days. Under color code red for measles is the child who's having any danger signs with the following complications of measles, that is crowding of the cornea or deep or extensive mouth ulcers. This you classify as severe complicated measles, where the signs of crowding in the cornea and extensive mouth ulcers are seen. That is severe complicated measles. So how do you treat? Give vitamin A, the first dose of the appropriate antibiotic. Okay, for crowding of the cornea and the likes, you can apply tetracycline and refer to the hospital. Alright, so that is how you treat measles and fever. So now, with that discussed, we can look at a child with ear infection. A child with ear problem is assessed for ear pain, ear discharge. If discharge is present, you need to ask for how long the child has had the discharge. Tender swelling behind the ear, that is a sign of mastocytitis. If there is a tender swelling behind the ear, that is a sign of mastocytitis. So the other condition that we assess for is ear infection. So when you're assessing for ear infection, you need to assess for ear pain, ear discharge, and if the discharge is present, ask for how long, okay, to establish whether it's chronic or acute. Okay, so you can assess ear infection in the following format. Ask if the child has had an ear problem. If yes, okay, there is an ear pain. Ask if there is an ear pain. If there is ear discharge, you need also to ask. If yes, ask for how long. You can look and feel for pus draining from the ear. Feel for tender swelling or tender swelling behind the ear. Okay, so there are 4 classifications for ear infections. So under ear infection, the child with a swelling behind the ear, we can say mastocytitis. Or a child with some this ear discharge less than 14 days, then that becomes acute ear infection. A child with the ear discharge for more than 14 days, that will look at it as chronic ear infection. A child just having some ear ache and pain, then we say no ear infection, just some kind of pain that the child is having. So no ear pain and no pus draining, then we say no ear infection. Then treatment, no treatment at all, just give IEC. So the signs here again is no ear pain and no pus draining from the eye. So here we say no ear infection, and we say treatment is just IEC. So under classification for ear problem, there are 2 yellows that we need to observe. For chronic ear infection, okay, classification, and acute ear infection. So what would constitute the classification of chronic ear infection is when the child has the signs, that is, pus is seen draining from the ear or discharge reported for 14 days or more. Then this is a chronic ear infection. So you can dry the ear by wicking, treat with tropical, quinolone ear drops for 2 weeks, check for HIV status and follow up in 5 days. Then the other yellow color code for ear infection is for acute ear infection. So the signs you look for here is pus is seen draining from the ear and discharge is spotted for less than 14 days. There's also ear pain. Then this is just acute ear infection in under classification. So you can treat this one with an appropriate antibiotic, give paracetamol for pain, do some ear cleaning, and if discharge, check for also HIV status. Then the red code for ear infection is mastocytitis. So the red code in ear infection is mastocytitis. How do you tell, what are the signs that for mastocytitis? It's a tender swelling behind the ear. How is this treated? Use the appropriate antibiotic and give paracetamol and refer urgently. So these are the color codes under ear infection, where we have 1 green, 2 yellow for chronic and acute. And it's important that you know the demarcation as to what do we say as acute ear infection, less than 14 days, chronic more than 14 days. And also know the treatment. And then the red color or pink color is mastocytitis. So now let's look at checking for malnutrition. Under IMCI, how do we check for malnutrition? So malnutrition is a condition that occurs when food eaten is not enough or too much than the body requires. So nutritional terms that you need to acquaint yourself are under nutrition, which is a condition which occurs when a person's diet does not contain enough nutrient to meet the body requirements. When you say acute malnutrition, or wasting, this is the condition in which a child suffers sudden weight loss or edema for both feet. There is inadequate food intake and or illness within the short period of time. So acute malnutrition, there is presence of edema of both feet. There is inadequate food intake and illness is within the short period of time. Then other terms that we use under malnutrition is underweight. This is when a child weighs less than they should for their age, or low weight. Then the weight edema means swelling from fluids in tissue, which is characteristic of kwashiorkor. When you use the term severe wasting, this is a child who has reduced his subcutaneous fat and appears like skin and bone. So these are signs of marasmus. So there are 5 methods used to assess nutritional status of children, which include edema of both feet, middle upper arm circumference, weight for height or length, height for age. So you can ask if there is history of weight loss. Look and feel. So what do you look and feel for? Look for visible severe wasting. Look for signs of acute malnutrition. Look for edema of both feet. Determine weight for height and length. And give a score. Measure middle upper arm circumference in a child 6 months or older. You can do the middle arm. So that is for a child who is 6 months and older. So you can look at the growth curve. If weight for height or length less than 3, that is Z score, or middle upper arm circumference is less than 115 millimeters, then you can check for any medical complications present, any general danger signs, any severe classification, pneumonia with chest indrawing, or if no medical complications, and the child is 6 months or older. So offer something to eat or some kind of formula to the child. So if you're not able to finish the foods that you are giving, even feeding using NG tube can be done. A child less than 6 months, you can assess breastfeeding and see if the child has a breastfeeding problem or other prevailing conditions. So in malnutrition, color code red is complicated severe acute malnutrition. The signs and symptoms is visible severe wasting, edema in both feet, weight for height less than 3Z score, middle upper arm less than 115 millimeters, and any of the following like medical complication present or not able to finish, that is not able to feed nicely. So you can give first dose of appropriate antibiotic and treat the child to prevent low blood sugar. Okay, keep a child warm and refer urgently to the hospital. Then the yellow code for classification of nutrition status is when the weight for height and length is less than 3Z score, or middle upper arm circumference is less than 1.15 millimeters, and is able to finish. Okay, is able to finish the food that you give. So then this will be severe acute malnutrition without complications. So how do you treat this? Give unnecessary oral antibiotic, assess for TB, advise when to return. Okay, counsel mother on how to feed the baby, how to make meals, and follow up in 7 days. The other yellow color code is when weight for height is between 3 and 2, and scores or middle upper arm is 115 millimeter. So now this one will be classified as moderate acute malnutrition. You can assess the child's feeding and counsel the mother on feeding. If the child problem, follow up in 7 days and assess for TB, advise when to return immediately and follow up in 30 days. The green code under classifying nutrition status is weight for height is 2Z score or more, or classification of middle upper arm circumference is 125 millimeters or more. So no acute malnutrition. That will be the classification. No acute malnutrition. If child has less than 2 years old, assess child's feeding and counsel mother on according to the feeding recommendation. So these are the color codes within classification of nutrition status. Then assessing for anemia. So you can look for palmar-pallor. Is it severe palmar-pallor, some palmar-pallor, or if palmar-pallor, do malaria test. Kindly note that if malaria test not available, you can give an oral, that is an oral antimalarial. If child has severe acute malnutrition and receiving some formula feed, do not give iron because there is already adequate amount of iron in the RUTF feeds. Okay, so now classification of anemia. So we have under green, no palmar-pallor, no pallor in the palms. So classification will be no anemia. Then identification of treatment is just simply giving IEC and assess the child is feeding and the other problems. Then classification yellow under anemia is there is some palmar-pallor. So this will be anemia. Give iron, give oral antimalarial, give oral anti-helmintic drugs, okay, to reduce worms. That is for a child who has had a dose. So the child who's 1 year or older can receive mebendazole. Okay, and advise when to return immediately. Follow up in 14 days. If the child has severe palm pallor, then that will be severe anemia. Urgently refer to the hospital. So in anemia, we just look at the severity of pallor in the palm. Okay, so it's from no palm pallor to some palm pallor and then severe palm pallor. Okay, so you can also do classification under IMCI for HIV infection. So assessment for HIV infection, if the child has no severe, that is for HIV. If the child does not have, let's say, you can look at this one. Okay, for HIV status, for yellow, classification yellow, confirmed HIV infection, that is for yellow. So here the signs are positive virological test in a child or positive serological test in a child 18 months or older. So here you have to give cotrimoxazole as prophylaxis. Then afterwards you can give antiretroviral drug, assess the child's feeding, advise mother on how to care, refer for further assessment at the ART clinic and follow up in 14 days. So here it's simply referring for ART management. Though it's under yellow, we said referral is for red, but now this one is a special clinic for ART that you need to, the child needs to start attending. So certain things you need to know is that if mother is HIV positive and child is negative or unknown status, you can ask if the child was breastfeeding at the time or 6 weeks before the test. So is the child breastfed now or is the child breastfeeding now? If the child is breastfeeding, ask if the mother and the child are on ARV prophylaxis, because this helps in knowing the status nicely or current status of the baby as to what possible status that can be. Okay, so if the child has no severe classification, you can proceed. That is, first ask if the mother and the child had the HIV status test, or then you can note HIV status, mother HIV positive or negative, child HIV PCR positive or negative, then serological tests and other things. If no status are known, then the test, you can test the mother. Okay, so the other classification of yellow is for the child who is HIV exposed, but the final test has not been done because maybe the child is still breastfeeding. So the signs are mother is positive and negative virological test in the child, or if only the child stopped less than 6 weeks ago, or mother HIV positive, child not yet tested, or positive serological test in a child less than 18 months. So if the baby is still breastfeeding, you wait for about 6 weeks. That's when you do a confirmatory test. It is encouraged whether mother positive. Okay, so baby should, positive or negative, baby should at least breastfeed for 18 months. Okay, so if the child is still breastfeeding, it's important that you note that here we have, under classification, we have HIV exposed baby who is still breastfeeding. So here under the identify, treat, it's giving cotrimoxazole prophylaxis. Okay, you can start or continue also on ART prophylaxis and do PCR test to confirm HIV status. Assess the child's feeding and provide appropriate counseling to the mother and advising the mother on home care. Follow up in 14 days, okay, as per immunization schedule. So the green for classifying HIV status is negative HIV test in the mother or child. Then HIV infection, here classification is unlikely. So you can treat cancer and follow up existing infection, that is under identify and treat. Okay, so then you can also check for TB infections under IMCI. So you can ask about features of TB infection: persistent, no remitting cough or wheeze for more than 2 weeks. So documented loss of weight loss or unsatisfactory weight gain during the past 3 months, especially if not responding to deworming, together with food and or micronutrient supplementation. If there is fatigue, reduced playfulness, and fever every day for 14 days, okay, look for features of TB infection and you can now do X-ray. So classification for TB infection: yellow is for TB infection. Okay, the sign is a close TB contact, 2 or more features of TB. So you do X-ray, views TB. So X-ray suggesting TB. Then this is the TB infection, and classification is yellow. So identify and treat here is treat for TB as per national TB guideline, and register in the TB register, notify, trace contact, and manage according to TB guideline. It is important that if you find the child has TB, you also counsel and test for HIV if status are known. And you can now follow up monthly for review. Okay, so the other yellow under TB is TB exposed. So a close TB contact and no features of TB. So this is a child who is exposed to TB. So now, in identify and treat, you can treat using isoniazid for 6 months. Trace contacts and follow up monthly. Then the other third yellow under TB is all other children. Okay, so all other children under the sign, then possible TB infection here. That is the classification. So identify treatment here is performing the tuberculosis skin test, following up in 2 days, and follow guidelines as per test result. So under classification of this third yellow under TB, we are saying all other children is a sign, then possible TB infection, and here you have to do, to identify and treat, you have to perform the tuberculosis test and follow up. Okay, so you can then check child immunization for vitamin A and deworming status on the under 5 card. So if you want to be a good scholar of pediatrics, it's important that you understand the age, the vaccine that the child should receive. Okay, so at birth, the BCG or PV0. Okay, then at 6 weeks, we have DPT, then we have Hep B and Hep 1, then OPV1, rotavirus, okay, and PCV1. So PCV1 at 6 weeks has to be given. Then at 10 weeks, we have DPT, Hep B, and Hep 2. OPV2 will be given. Rotavirus, also rotavirus vaccine will be given. And PCV2, pneumococcal conjugate, that is for pneumonia vaccine. So vitamin A supplementation, you can give every child a dose of vitamin A at every 6 months from age of 60 months. Record the dose on child's chart. So at 6 months we give 100,000 international units, and then at 1 year you can give about 200,000 international units. At 14 weeks we give DPT, Hep, and let's say DPT, Hep B, hepatitis B vaccine, and Hep 3, and we also give OPV3. Okay, so you can also give PCV3. So at 9 months, you give measles first dose. Okay, so routine worm treatment is given to every child, that is child albendazole every 6 months from age of 1 year, and record dose on the child's card. At 18 months, we give measles booster dose. Remember, do not give OPV0 to an infant who is more than 14 days of age. Okay, so that wraps up the end of our lesson on how to assess and classify a child who is 2 months to 5 years. So, what are some of the techniques that can help you remember how to manage the child according to IMCI? So, the techniques that can help you is knowing the IMCI process. So, the IMCI process is about assess, classify, identify treatment, treat, and counsel. During assessment, you ask, look, and feel. During classification, we have color codes: green, yellow, and red. Okay, then treatment, you can apply your pharmacology in identifying treatment and also in treating the child. Then you can also counsel the mother, because in each and every, or for each and every level, you need to give the appropriate information, education, and communication. So that is actually how you can understand better IMCI and apply it by knowing the process, knowing the questions to ask, knowing what to look for, what to ask, what to feel for. Okay, and also knowing the equipment that are supposed to be used and the drugs that are supposed to be used. So that is our lesson for a child, for IMCI for 2 months up to 5 years old baby. So that wraps our part 2 of IMCI. If in case you have problems, please you can still listen to this lesson and get back to us so that we can offer some classification. So this one, IMCI, mostly is for the sub-Saharan region. Other areas of the world, of course, may have other diseases that they can use for IMCI. Okay, so we are just necessarily looking at the diseases that are common in the region of sub-Sahara. So thank you very much for following up this lesson.